So I'm getting ready to pull some drugs for my patient. And so the first thing I'm going to do is check my order sheet with the MAR. I note that I'm pulling drugs for a patient named S. Smith, which matches up on both the physician's order sheet and the MAR. And then I note that the allergies for the patient are to sulfa and statin drugs, so I need to keep that in mind when I'm checking the drugs before I pull them. I'm also going to check to make sure that there's nothing of concern from the patient's assessment. And also before I would administer Coumadin, I would need to have my patient's INR checked. So I'm going to compare and make sure that the physician's order sheet lines up with the MAR, and it does, apart from the Sulflexin, which is on the MAR. It says it has been administered at 9 a.m., but it is not on the physician's order sheet, so I would contact the physician and make sure that this is what he wanted to be administered to the patient, and it was ordered. And so once that has been checked, I'll move on to actually pulling the drugs from the machine. So the first thing I see on here is metoprolol, 50 milligrams once daily. And so I see 50 milligram metoprolol, and that matches, so I place that in the patient's cup. Then I see that there's Coumadin, 5 milligrams. So I have my Coumadin multi-use 5 milligram bottle. Open that up, careful not to touch the medication with my bare hands, and pour one of those out and into the cup. And then finally, they're also ordered for a multivitamin once a day, and so I want to make sure that matches up, and it does. So I place that in the cup. And then finally, they're ordered cephalexin, 250 milligrams for 5 milliliters once a day. And so I will bring this to the patient's room with me. And normally I would use a oral syringe, but in this case I do not, so I will be pouring it into a measure cup for the patient. So, and then I will also be taking the patient a cup of water for them to swallow their medication. And before entering the patient's room, I'll make sure to wash my hands, and then also put on gloves before I touch the medication, because I do not want to touch it with my bare hands. So now I've entered my patient's room, and I'm going to prepare to administer the medication. Good afternoon. My name is Jordan. I'm going to be your nurse taking care of you today. Can you give me your first and last name, please, and your date of birth? Sam Smith, 120588. Matches up with my MAR. I'll also scan the patient's badge to make sure that matches up with the MAR. Is there any preference you have for your medication name? I've got 1 liquid and 3 pills for you to take. Liquid first? Okay, and then you think you can take all 3 pills at once, or would you like them one at a time? All at once. Okay. So now that I have confirmed my patient's preference, are there any allergies that you have? Sulfa and statins. Okay. So the patient's allergies also match up with my MAR, and I know the patient's preference for how he'd like to take the medication, so I can move on to administering the medication. Before administering the beta blocker and the Coumadin, I do want to make sure that I check the patient's heart rate and their blood pressure. So now I will administer the cephalexin. So sir, this cephalexin right here is just an antibiotic, and it is for the bacterial infection that you're dealing with. And I will make sure and scan that with the barcode and make sure they match up before I administer. Then I'll move on to administering the oral medications. I will open them up the pill medications. I'll open them up one at a time and scan them with the patient's wristband to make sure that they match. So this first medication we've got right here, this is Coumadin. And this is a blood thinner, and this is going to be for your blood pressure. So I'm going to put that into the capsule, or into the cup. And then the second pill I have right here, it's a multivitamin. This is just basically for your general health, while while you're here with us. And finally, metoprolol. This is a beta blocker, and this is for your blood pressure as well. So now that I've checked all the medications again by scanning their barcode and comparing to the patient's barcode, I can then administer to the patient. So I'll provide them the pills and a cup of water to take them. Upon completion of the administration, I will return my multi-use bottle of cephalexin to the Pyxis. I will assess my patient and make sure there are no further needs that they have, and then I will dispose of any oral syringes or any equipment that I used during my administration, and then I will document immediately after administration. I will document on the MAR what medications were administered.